All right, welcome everyone to session 2 of our spring 2023 Recruitment Boot Camp. Welcome back. Just wanted to say happy Wednesday afternoon to everyone from the Star Center team. And today you've got myself and Mariah, and also Michelle will be behind the scenes putting helpful links into the chat as we go through things today. Helen is still out, but she will be back, I think, after the next session. You'll get a break from me and you can have Helen as your host. But as always, we're here on behalf of the Association of Clinicians for the Underserved, and specifically ACU's Star Center, the HRSA-funded NTAP that provides all of these free resources to health centers and PCAs. And at the Recruitment Boot Camp today, just remember to stay on mute unless you're sharing, and we're going to have an opportunity to go into breakout rooms and discuss the homework from the last session. So we'll go over that assessment that you all did and discuss that, and then we'll go through the presentation for today. And as always, make sure that you're open to learning from each other. This is about getting to network and learn from your colleagues as much as it is to have the presentation from the Star Center as well. All right. And so expectations, just remember the coursework that we provide you through these sessions is going to be really helpful in building that workforce plan. And so just remember to try to get those things completed before you come for the next session. So after today's session, we will give you links on the discussion board to 2 more. They're fairly short assignments, but they will be really helpful in building out those first parts of your recruitment and retention plans. Oh, and our learning objectives, as always, will be to assess your health center's current recruitment processes and then develop and update your retention and recruitment plan and then implement, right? Afterwards, when this boot camp wraps up, we'll have everyone go and actually put into practice the things that we've talked about this session, the past session, and in our upcoming ones. And then real quick, let's go back over to Mentimeter, just in case anyone is joining us for the first time. Mentimeter is kind of a little polling app that we use. And so you can either access it using the QR code function on your smartphone, that QR code there, or we can have, or you can click on the link in the chat or go to menti.com and type in that code. And thank you, Michelle, for putting that in the chat for us. I'll give everyone just a second to get logged on there, and then I will pull up the Mentimeter. And today we're gonna do kind of a fun thing. It'll be a Mentimeter quiz. So bear with me. Hopefully I don't advance too soon and give away the answer. But if you're logged in, you should see the first question. Let me get that pulled up here. Okay, looks like we've got a bunch of players ready to go. 9 people got in. If you have any issues, you can always put your guess in the chat. You just keep saying quiz not open. It should be open now. Okay, press enter to start quiz. Okay, you should be able to see the question now, hopefully. Okay, which country has the most islands? So you should be able to choose from either Sweden, Russia, Madagascar, or Florida. Everyone's voted. Excellent. Okay, so otherwise it was going to show the answer right away. So I didn't put it on this slide. So just because it says you're not correct doesn't mean you're not correct. But our guesses are Sweden with 1 guess, 4 guesses for Russia, 7 guesses for Madagascar, and no one guessed Florida. That's good. That was my trick question. Florida is not a country. It also doesn't have as many islands as the correct answer, which is Sweden. And Sweden has over 200,000 islands, which seems excessive. All right, ready for the next question? All right, looks like everyone's ready. Question should be popping up here in a second. All right, where is the only tropical rainforest in the United States? This might be a tough one, or it might be a really easy one. I don't know. All right. So again, I didn't put the correct answer in the thing so that it wouldn't just pop up right away, because I also wanted people to be able to put their guesses in the chat. So let's see, we have a guess for Florida, one for Hawaii. That's a good guess. North Carolina, Australia, not part of the United States, little known fact. Hawaii, again, and Puerto Rico. And we had a guess in the chat of Oregon State. So remember, tropical rainforest, because Oregon, I think, does count as a rainforest, but it's not tropical. So our tropical rainforest is in Puerto Rico. It's the El Yunque National Forest. All right. Ready for the final quiz question? Okay, what is the name of the deepest point in the Earth's ocean? In the chat, I think it's a temperate rainforest in North Carolina, but I am not a meteorologist, rainforest scientist. I don't know. So I'll double check that one. I'll try to figure that out for next week. Confirm that one. Okay, what is the name of the deepest point in the Earth's ocean? So we had one guess for the Michelle, help me out, please. The Chicxulub.
I don't know how to pronounce that either.
Hello, the X is an H sound, right? The Chicxulub crater.
Depends, but yes, you probably have it right.
That's the big crater in the off the Yucatan Peninsula where they think the asteroid that killed the dinosaurs hit. We're learning all kinds of weird non-workforce related things today.
I think it's Chicxulub or something like, well,
okay.
Sorry.
Oh yeah, Chicxulub. That would make sense. And then maybe the Galapagos Islands. We had a couple guesses for that one. We had 6 for Mariana's Trench. I don't know who Mariana was, but she named a deep ocean trench. And then wherever the Titanic was, and I think that was my other fun answer, but I think that was pretty deep. Let's see. So the Marianas Trench was the correct answer, and that is over 36,000 feet deep, which is wild because that's, I think, deeper than Mount Everest is tall. Well, congratulations to everyone. Thanks for participating. I hope that was fun. And I'll look up that North Carolina thing. I'm curious now. Maybe I messed up on one of the quizzes. All right, let's go back to our slides here. No. How do I share the correct thing? I apologize, I lost my slideshow. Okay, there we go, we're back. All right, there were the answers to the quiz, and we'll jump back into workforce stuff, but thanks everyone, that was fun doing the geography quiz. So again, today we're going to focus on building that data-informed workforce plan, as well as going through some tested recruitment and retention strategies. We're going to look at recruitment very specifically today. Remember, all of these are in that comprehensive workforce plan. And if you need the link for that, Michelle, I believe, will be putting that into the chat here. And again, this comprehensive workforce plan, it's a template that you can download and you can edit. You can make it your own. So again, as we go through things today and start really building out through the coursework that you all get after this session, you'll be able to start really building out that plan and really making it into something that you can use to plan going forwards, and then eventually pass on that knowledge to whoever succeeds you in your role. All right, so the workforce self-assessment tool, that was the homework that everyone hopefully did after the last session. And that went through the provider capacity assessment, infrastructure for recruitment and retention, the actual plans for retention and recruitment, leadership, compensation, and other strategies. So hopefully everyone was able to do that and got some feedback. And so we're going to go, let's see, how many participants? We have 23 participants. So we are going to go into some breakout rooms. And hopefully you can all discuss with your colleagues kind of what did you get out of that assessment, right? Did you learn anything new? Did you find any like, oh, this is an area we need to focus on? And what was the process of that like? And did it give you anything to reflect on? If you weren't able to complete it yet, kind of think about like what elements are you most curious about getting feedback from the assessment on when you do go through the workforce assessment? And then what do you think is one challenge that you might encounter and might be elucidated by filling out that assessment? Okay, welcome back everyone. And I hope that was a good discussion. From each breakout group, do we want to have one person just kind of report out on any big takeaways or anything folks found useful? We'll start with anyone who is in room 1.
I think that was our group. We talked a lot about the fuel gauges. We thought that was really cool and telling to see where we were at. And with my organization specifically, it was pretty nice to see that I think we're kind of on the right track with what we think we need to improve on based on those gauges.
Terrific. Yeah, it's always nice to get an indication that you're heading in the right direction. All right, anyone from group 2?
I guess I can go ahead. I joined the group a little bit late, so I didn't hear anyone else speak. But just from my name is Neelam. I'm the director of HR at Ole Health. From my experience of completing the assessment and getting the results, it was pretty cool to see that the areas that were right in the middle for most part. And there's one section that I talked about that we were almost at a full tank, which is the health professions training program. So we do accommodate a lot of students from different programs, and that was kind of where we were at almost at full tank. But the rest of the areas, I think that we do need to focus on and make improvements. So hopefully we'll take this and learn from that and apply some things to hopefully get to that full tank.
Terrific. All right, and let's see, anyone from group 3?
Hi, this is Sandra Green. I will share, I would ditto what the first 2 individuals spoke on as well. I thought the fuel gauges were awesome because, again, at a quick glance, without having to actually read the narrative, you kind of sort of knew where you were. Also, we were just, sharing things and learning that we all have the same pains when it comes to recruitment and buy-in and things of that nature. And then Danielle, who was in our group, actually shared her philosophy when it comes to recruitment. So that was helpful too, because it gave me a little bit of insight. I jotted down a couple of things that we're not currently doing that will probably be helpful for us as well.
Excellent. I'm glad everyone liked the fuel gauge indicators. I feel like it would be really nice if I just had one of those on every project I was doing, and it could just tell me, like, how am I doing here? How am I doing there? But yeah, I'm glad everyone found that useful. All right, so let's jump back in. And I think everyone who was able to make the last session is going to be familiar with, oh, and let's see, someone in the chat asked about resharing the link. So I think Michelle will be able to send that. And then also the link to that assessment is under the session 1 tab on the discussion boards as well, that you have access to. And if you need the link for the discussion boards, we'll have it at the end of the session today as well. And then everyone that was able to attend the last session will probably recognize this recruitment planning ladder that we have. And as we start going through this session, the next ones, we're going to start hitting specific points within this ladder and really drilling into some of the details on those. Work. There we go. It was an animation. I was excited to get to it. It just wouldn't work. But today we're going to look at community team priorities, budget, and recruiting firms. Again, as we go through each one of these, they're going to be different for all of you. There will probably be some overlaps. Like was just mentioned, there's a lot of times a lot of overlap as far as challenges to recruitment and staff retention as well. But remember that some of these things may look a little bit different for each of you. And so just as that template for the comprehensive workforce plan is flexible and adaptable to your needs, just remember that each of these things may look a little bit different for what your capacities and capabilities are, what your resources are, and what your staff needs are. So think about for recruitment planning, as we're doing that assessment, what's working for you and what's working against you, right? And so when we get into the community, you may have community partners, right? And you could have hospitals, and those can be competitors or they can be partners. And sometimes they're kind of both, right? They might be a competitor as far as recruiting staff, but they could also be a partner if you say are coordinating for a health professions training program or are able to rotate providers or share staff, right? You may have a lot of options for having staff part-time at one organization and part-time at another. And so there can be opportunities to partner, but think about like, what are the challenges there, right? A lot of times we hear hospitals can pay more, but health centers often are able to offer much better benefits. And so kind of thinking about what are your opportunities there as far as recruitment and retention. Schools, right? We hear about health centers that do, say, apprentice programs working with primary education schools. So like a high school that has a vocational track for students. Some of them may be interested in healthcare and may want to go and do an MA apprenticeship. So that can be a big opportunity for recruiting future staff and working with the community and everything as well. But also just getting the word out to, technical colleges and state colleges and universities and things as well about the existence of your health center. And most of those organizations are going to have some sort of health professions training program that you might be able to take advantage of, even if it's just going and letting people know about the health center's existence. Just a little bit of time can yield huge results. State offices, right? Working with the state, sometimes states have funding for health professions training or other activities that the health department might engage in. That the health center might engage in, and possibly coordinating with state health departments and things like that. Primary care offices, right? And then your PCA is obviously a big go-to resource for a lot of things. And then when we're thinking about recruitment planning, what is happening in your area? And we mean that as far as kind of what are trends looking like for things like what's living in the area going to be like for people. Because when you're recruiting some positions, you might recruit people from out of state or at least out of your local area. Other positions you might be recruiting from the area. And so kind of knowing what's going on around you can be one, a way to determine how are we going to draw people in from outside, and two, how are we going to recruit people and retain them if they're living in our area, right? If cost of living is something that is going up, we might need to be evaluating wages and trying to figure out possible workarounds for that, ways to help our staff manage that increased cost of residence or other costs of living. You might have a lower cost of living because you're in a more rural area, and figuring out how do we make that clear in our job announcement and hope to draw people in who are looking for a little bit less expensive place to live than a lot of more urban environments are becoming. And then things like the local school system, right? If you're recruiting any staff from out of the area, then being able to, let them know, oh, here's, great schools or great programs or community activities or things. You want to know all of the good things about your community that you can use to, inspire potential candidates to want to come in and stay and work in your community. And then also working with other organizations. And it might be kind of a direct partnership, but it might just also be knowing what other resources are available in your community. So you can connect people to care opportunities beyond the healthcare that you're providing, right? If they need other social services and things, being able to offer that is going to feed back into staff retention, because staff are going to be more satisfied if they know that they're able to get people the resources that they need. And so having those community connections can be really valuable. They can also be valuable for recruitment, right? Especially if you want to recruit within your community, reaching out to other organizations in your area can become a good source of finding people who are motivated to serve the community in which they live and might want to work at your health center. All right, so the team, your recruitment team. And you want to think through who should be on the team, what makes them best suited for what role within the team. And then you do want to define those roles and make sure that you don't have any big gaps in your team. Okay. So putting that team together in advance of writing of job advertisements and beginning that recruiting process is really important, because you want to have a very clear job advertisement that speaks directly to people who are in that field applying, right? For example, my clinical background is in, as a paramedic. So like I am not very conversant in mental health things. And so if I were writing a job description for someone for a position that was mental health in nature, I would need to talk to someone who actually is in that role. I would go to Michelle and I would say, hey, Michelle, like, can you help me write this job description? Because I want to use the right terminology. I want to use up-to-date terminology. I don't want to use things that would kind of show that someone who doesn't really understand the job is the one writing the description, because then someone reading that is going to say like, well, this is probably not actually a very thorough description of what the job entails. So I really want to make that job description understandable and relatable to the person looking at it based on their field. Where are they coming from? So once we have our team put together, we have all the people we need from leadership, from HR, someone representative of that position that we're hiring for to help inform the job description and things like that. We want to establish the roles and responsibilities, and we want to kind of parcel out, what part of the recruitment process is each person going to handle. And then as we build out that team and begin our process, we want to think about defining the position that we're hiring for. What community partners are we going to work with, right? Again, you might be reaching out to a learning institution that has a health professions training program of some kind. Let's say there's a college that has a nursing program, right? If we're going to be trying to recruit nurses, we may want to go reach out to them and talk to them. One, obviously, they have students that might be graduating soon and looking for jobs, but they may also have alumni job boards and things like that, where they can reach a broad network of people that we know are going to be skilled in the position that we're looking to hire for. So that helps with sourcing candidates. We also want to think through our screening and interview process, right? What's that going to look like? How many interviews are we going to do? If we're hiring people that are potentially going to be from out of the area, are we going to bring them in? We'll have to worry about logistics for that. If they're going to do visits, if we're hiring people who are in our local area, again, how are we going to set up a time for them to come in and interview and see the organization, who's going to talk to them, all of these things. So we want to have all of this planned out ahead of time. And that process becomes really smooth when we have the right people in the right place and everyone's bought in the process and bought in because they know their role, right? They're like, this is my responsibility in building this part of the recruitment, and establish priorities. So we want to define our large scale priorities. And this is really the place where we start thinking about how we integrate JEDI principles into this whole process. And we'll talk later on about interviews and kind of how you integrate JEDI into the interview process. But it should also go into your job announcement process, right? Where are we going to advertise our jobs? I think a really powerful thing I heard about an organization, they said they had a cohort that they were recruiting. They said, this is the most diverse cohort we've ever had. And one of the people in that said, like, well, why is it diverse? Did you like lower standards? Is that why I'm here? And they're like, no, we kept all of our standards the same. Like everything across the board is the way we've done it. What we really changed the most was how we did outreach and where we sought people from. Because before, that organization had done primarily word of mouth recruiting for that particular program. And they said the thing that changed for them, their diversity the most, was just recognizing that, like, well, if you start with a group of people that all have a pretty common identity, that all look the same basically, and you just do word of mouth, you're just very unlikely to expand that circle very wide, right? And so if you think about like, oh, are we lacking, potentially diversity within a certain identity group or something, how can we expand our recruiting so that we begin to get people coming in, might be engaging with minority serving institutions or historically Black colleges and universities. It might be reaching out to organizations that work with people who fit other, say, a disability identity or any other kind of identity group or intersectional groups, and just kind of expanding that recruiting process. So things like that are what you want to walk through when you're considering how you integrate JEDI into each of these pieces. And then we're going to build out that strategic plan, like I talked about before, for exactly how our recruiting process is going to go. We want to update it as new information comes available, right? We might have someone say like, oh, when I got hired, like this was the job description, but now that I've done the job for a few years, like this, it really doesn't fit. Okay, well, we need to update the job description for that position. And so you just kind of keep track of those updates as they go along. And that's what the comprehensive workforce plan is really helpful for doing. And you can attach into that, your different job descriptions that have been written by people who have actually done that job. As far as prioritizing let's see, real quick in the chat, how do you identify a realistic timeline? So that can be kind of challenging. Some of it's going to be based on what you've experienced before. If you're hiring for a role you've never hired for before, then you may just have to be flexible and be ready for that timeline to expand or contract. But generally, once you find candidates, we want that follow-up to be really fast. So it should be searching and continuing to reach out. And then as soon as you start getting people applying to the job and you have candidates that are qualified, right, meet your qualifications and everything, you want to reach out to them right away and you want to get that process going quick because you don't want to lose them, right? People don't usually apply to just one job. If they're really on the job market, they might, if it's like a referral from a friend or something, they're not really looking, but if they're truly on the job market and available, they're going to be applying to multiple positions. So you want to follow up as quickly as you can. And usually that's going to be kind of a rolling process. And so, there are different statistics that you can find. They've done surveys for, say physicians, a lot of primary care physicians. And it takes about 6 months to go through that whole hiring process. And a lot of that is just finding candidates. And you usually do a few interviews, but you really want that process from application received and reviewed. And so we've determined, oh, this person's qualified, like, reaching out to them that next day or the same day, and then scheduling an interview within that week, like a phone interview or a Zoom meeting or something to do that initial interview. And then if they make it to, if it's say a 3-interview process, they make it to the next one, you want to do that as quickly as possible. If they're going to have to, say fly in from out of state, that might take a little bit longer to arrange the logistics, but you want to keep in good frequent contact with them. So basically that timeline is going to be, a big chunk of time as far as putting out the job announcements. But, once you do, you have that kind of liminal space where you don't really know how long it's going to take to start getting applications back in. But then once you get qualified candidates, it's going to roll really quickly. So timeline stats for various positions. So as far as resources for them, I think SHRM, the Society for Human Resource Managers, if I'm remembering that one right, I think they have some stuff. You can look around. We also have our employee turnover tool, which I don't know if Michelle has a link for that, but it's for calculating cost.
I'm sorry,
Okay.
I'll grab the link
Okay.
and put it in there.
Yeah, these are really great questions. So sorry we're getting sidetracked from the slides, but yeah, like figuring out the timing can be kind of challenging. But in this turnover calculator tool, there are citations. And so you find the line where it says how long it's going to take to turn over the provider. And there are some citations there from different organizations that have done surveys on this. I wish there was a comprehensive resource that just said, well, for an MA, it takes about 6 weeks to hire. And for a physician, it takes about 6 months, and a PA 2 months. And that just doesn't exist, unfortunately. So it's a lot of searching around. It's going to vary by area as well. And so that's going to be pretty particular to you. In the comprehensive workforce plan, we have a tracking document for all of these hiring processes. And so you'll be able to note down how much time it takes you to find a candidate for a position. So then over time, as you do more hiring, you'll be able to look back and see like, oh, wow, yeah, it's really consistently taking 3 months to hire this position. Or, oh, we've shortened it down from it took a year, back in 2019, and now it's taking us 3 months to find someone for this. So we've done a good job of streamlining our process, things like that. So you'll be able to track it and figure it out specific for your organization, because it is going to vary a lot. But yeah, very good questions on the timing. Thank you. And so going back to the slide and looking at length of time to fill positions, right? Some of that's going to be an estimate for you. And you also want to look at reasons for vacancies and, open positions that you have going, and try to anticipate vacancy needs. And so if we look at reasons for vacancies, a lot of times we might be able to know ahead of time that a position is going to be vacant. And that can really reduce, it may not reduce the amount of time it takes to recruit and hire someone to fill that position, but we may be able to overlap that time with a frame where that's already filled, right? So if we know a provider is retiring, or not just a provider, any position, if we know a position is retiring, we want to talk to that person and figure out, okay, like when is your last day going to be? And then plan backwards from that and say like, okay, well, we want to start our recruitment process 6 months before and work on finding someone to go fill that in. And it doesn't have to be retirement, right? It can be, oh, this person knows that they're moving on to another position. Like, that's okay. And it's okay to have those conversations with people. And if someone's destiny career-wise really does lie with another organization, it's better to just have that conversation and be supportive and say, as long as you're here, like, we will support you and work with you. And if you need to go somewhere else, we just want to know as soon as possible so that we can work to hire someone to fill that position before you leave, or before that position is open for too long. So sometimes the more challenging but important conversations that you have with people, the less kind of gap time you can end up with in those vacancies. All right, and budget, right? We always have to pay for stuff. And thinking about recruitment as an investment can be a really important way, especially if you're talking to your leadership and trying to say, like, we need to put this money into really doing a good job getting our job announcements out there and targeted to the right areas, or say working with the right partners. But oftentimes for a relatively minor investment, say like an hour or two of time, going to a college or university that trains health professionals, you can get a lot of return, right? If you need medical assistance and there's a program in or around your community that's training them, going and talking to them and letting them know about the health center can be really, really valuable. And a lot of colleges especially are going to be really happy to have someone come in and talk to their students about how to actually get a job and talk to them about that process. So sometimes it's a relatively small investment in that recruiting process that can pay really big dividends as far as shortening that time to fill positions and expanding the number of recruits that you might have. And then the recruitment budget, things to take into consideration, right? Staff time and costs, which can be a pretty big one. Interview expenses and hiring expenses, right? You have to onboard people. If you're interviewing someone, flying them in from another location, or paying for them to drive in and visit, that can end up being kind of costly. You want to consider things like, oh, if they're coming in, if they're going to be relocating to another state, do they have a spouse? Do they have kids, that might need to come with them? How do we provide for that? What meals are we going to provide? What kind of housing and everything? And then we also have outside recruiting expenses, right? Are we going to consider using a recruiter? We'll talk about this a little bit more in a bit, but that's going to be kind of a decision that you'll make, again, based on your own unique needs and experience. Okay, so planning for a realistic budget, this table is from the Comprehensive Workforce Plan, and it just helps you make sure that you're not missing any little pieces to that recruitment cost process. And just remember, when you're building those recruiting costs, turnover is really expensive. And again, thank you, Michelle. She put the turnover calculator tool link in the chat. And that tool is something that we've developed and recently updated. So it has very up-to-date kind of average numbers that you can select, or you can put in your own. It's designed to help calculate the cost of turning over either a physician provider or another, excuse me, or another provider like a PA or a nurse practitioner. So it's focused on that, but you could also, pick and choose which numbers you put in and probably tailor that to almost any position in your health center to figure out how much does it cost to turn over, billing staff or a manager or any of these other positions. And, that turnover process includes like separating the current employee, so offboarding, and then all that time spent on recruitment and then onboarding a new employee, including their ramp up time to productivity, right? Because if we're talking about patient visits and everything, if someone takes time to learn the system, they'll become more proficient and they'll increase their productivity. But initially, it's probably going to be a fair bit lower than someone who's been working with an organization for a year or more. And then we need to engage them and retain them. And that's all part of that turnover process, right? Because if we find someone for a year and then have to turn them over again year after year, that can add up to a huge amount of money. So when you're going through this financial assessment process, thinking about these turnover costs and everything, just think about what is turnover cost versus what does some investment in recruitment costs. And again, in the Comprehensive Workforce Plan, we have lots of tools to help you kind of track these costs and estimate them. Okay, now on to recruiting firms. And I'll just go over this briefly. There are tons of different recruiting firms and organizations and options, including ones that are a little more automated using some tools through Indeed and LinkedIn and things like that. They all cost different amounts. And it's basically just going to be your assessment of what do you think would be helpful. I would definitely vet any organization or tool that you're going to use and see like, what's this really going to cost us? And, is that really worth it? And then track if you are using one. And again, we have a table for this in the Comprehensive Workforce Plan. Track those costs associated with that recruiting firm and track their successes and see how much money am I putting in for how much output are they delivering? Because if we're paying a ton of money to a recruiting firm and we get like one person out of them versus our team has hired 3 people, well, like that wasn't a really worthwhile investment in the recruiting firm, probably, unless that one person was one really difficult to find. And so that recruiting firm really came through. So we want to kind of track those things and provide a little bit of context for like, is this really worth it? Are we getting out what we're putting in? And there are also, different pricing models with recruiting firms. If you can find one that is based on results, right? So where you don't pay unless they actually deliver a qualified candidate. And sometimes a qualified candidate that actually stays with your organization for a certain amount of time before you pay them, that can be a much better pricing model. And then also investigate. Sometimes they have discounts for nonprofits and things like that. So ultimately, to use a recruiting firm, to not use a recruiting firm, that's going to be your decision based on your own general context. But I think it's one where whether you go with it or not, I would track kind of successes and challenges and then reevaluate every year, every couple of years, whenever you update your Comprehensive Workforce Plan. Think like, all right, are we using a firm and we don't want to anymore, or have we not been using one and maybe it's worth kind of looking into? All right, and that just on this slide says everything I just said. All right, are there any questions? And we already had a few really good ones in the chat. Does anyone else have any? And you're welcome to put it in the chat, or you can come off mute if you would like. That's good. Stunned silence. That's what I go for. Especially on Zoom meetings, it's not disconcerting at all to just stare into a camera with no feedback. I can see one person laughing, so thank you, Kevin, for having your camera on. The only feedback I'm getting right now. Yeah.
Maybe I need to put my camera off too.
Oh, no, this is great. This is good. It's no, and that's the thing. This process is something that can be overcomplicated, right? On the one hand, you just need to get word out about the positions that are open, and then get as many applicants as possible, so you can sort through and find people who are really qualified, and you think will kind of add to your organization and also be able to fit in and mix in with it. But you know, on the other hand, if you just kind of throw caution to the wind and just go about things, you might use up a lot of time that's really valuable to you, a lot of human resources, and a lot of money, and not get a lot of product. But if you kind of put this front work in to really building good job descriptions, really good job advertisements, really being targeted with it, talking to current staff and saying, hey, where do you and your colleagues at other organizations go to look at jobs? Or how did you find this job? You know, what's working for us? And what do you know is working for other people in your field? That can really help you to target really more productive places, right? Because it can vary person to person, but it can also vary by, you know, career group, right? By people's different jobs. Like nurses look for jobs in a different place than IT specialists a lot of times. And so, you know, kind of talking to people and getting a feel for it. All right, and feel free to jump in if there's any questions.
And
But I will head over.
I was just going to say with Sandra's question, because I know this is a little bit different, but I did want to mention, so we usually recommend once you have someone, you're going through the process of communicating with them, to reply at maximum within 5 days and let them know what is going on through the process. So I remember, like Alex, when we were hiring you, I didn't always do that exactly, but I know that the goal was to keep you updated of like, we're still reviewing candidates, this is what we're doing, and I think that's really helpful, so the person knows where you currently are in the recruiting process for them, especially right now when people have so many choices. You don't want to lose someone because you were a day late or something like that, and there was another job that opened up and they were like, all right, I'm gonna go ahead and take that. So I just wanted to include that piece in there.
Yeah, no, absolutely. I appreciate reiterating that is be communicative with people as they're going through the process, because also I think we've all kind of experienced the oftentimes necessary world of like, no news is bad news, right? If you don't hear from a position you've applied to, you don't assume they're gonna call you back. You're just like, oh, they didn't want me, moving on to the next job application, right? And so if you know, wait too long in communicating with someone, even if they're partway through the process, they may just assume, well, they got distracted with someone they are hiring and I'm off the table now. So just, you know, every few days or once a week, check in with any candidate if some part of the process does have to take a long time. It's okay if it takes a little bit of time to get everything sorted out, but you do want to be communicative.
And we also did that with candidates that we know we were not gonna move forward, but always to let them know, like, never go silent with anyone.
Yeah, absolutely. All right. And so then before the next session, and again, this is all on the discussion boards. And I think, Michelle, if you don't mind putting in the link to that. And for anyone that missed last session, if you have any trouble logging into the discussion boards, please send any of us, but specifically Mariah, an email, and we'll make sure you can get access to it. But on your discussion board, you will find under session 1, the self-assessment tool link. And so if you haven't done that self-assessment already, we'd encourage you to go do it. Everyone seemed to like the fuel gauge indicators. And I do think it is a really useful, just kind of initial assessment tool. And then we have 2 Word documents. And basically those Word documents are just to help you begin this recruitment planning process, right? So as we're going through this, we're going to kind of start building some of these things we've talked about. And so before the next session, hopefully you'll come back with some ideas around the potential costs for recruitment and community resources and opportunities that you have in and around your health center. Oh, there was a graphic. Sorry about that. I didn't know there was an animation on this slide. Look at all those pages. All right. Oh, one more, Lord. I don't know how many there are at this point. Anyway, when you go to the discussion boards, go to the login, and then you'll click on the Recruitment Boot Camp 5.0 link. And that'll take you to the discussion boards. And again, you can put questions on there. I saw one question earlier today that we responded back to. And so feel free to communicate with us or to continue to network with your colleagues. There should be an evaluation popping up shortly. If you don't mind doing that for us, it's really helpful as well. And then we will see you for our 3rd session on March 15th. Same bat time, same bat channel.